Thank you, everyone, for your patience. My name is Ellie Happel, and I direct the Haiti Project at the Global Justice Clinic here at NYU, and I also am a staff attorney with the Global Justice Clinic. It's really an honor for me to be here today. We have an incredible group of panelists who've come from, each have come from different parts of the world. And this panel, as you see, it's on democratizing data collection, the power of community-generated data. And the themes, as you will see, are the ways in which communities challenge narratives that already exist, and the way that they create new narratives by generating their own data. The contexts in which the four panelists work are pretty different. People here are working both in the labor movement, in monitoring extractive industry activity, monitoring police activity and police enforcement, and then also with HIV populations in the Caribbean. We are going to begin with Daisy Arago, and Daisy is here from the Philippines. She is the executive director of the Center for Trade Union and Human Rights. And Daisy's organization monitors human rights compliance, both of the government and also of corporations. Daisy is also a member of the Asia Pacific Women for Law and Development organization. Daisy, thank you so much.
Yes, thank you. Okay, thank you, and good afternoon to everyone. Thank you for inviting me here. I will, my center is 35 years old. It's called Center for Trade Union and Human Rights, and it was founded during the Marcos Martial Law in 1984 in order to challenge, as she said, that challenge the dominant narrative, the official narrative, at the time where workers and peoples are being told what is about their life and how is their life being conducted by the state and by the corporation. So we were founded as a result of a fact-finding missions of the strike dispersal of one of the, actually it's a US company in Mindanao, which is in martial law today, that is saying that workers are happy with martial law at the time, that workers were contented, and the Philippines is enjoying an industrial peace, and that investors can come to the Philippines and invest their money at ease. So our center was founded to challenge that, because the time of martial law, which is also being repeated at the moment, where we are also in the situation where there's a lot of repression and oppression, and the people are being told what the state wants us to believe. So primarily, the context is we try to gather through the use of collecting stories, real people stories, because from now we believe that data is a representation or a mirror of the reality. It is not a representation of what the official statistician or what the state authorities would like us to believe, or what like people in different countries, especially the international community, would like to believe. So in terms of challenging that, I think from collecting people's stories, we want to present in terms of specifically the assertion of the freedom of right of association, the rights of expression, and at the same time in terms of labor standards and the working conditions and living conditions of workers, especially in transnational corporations-driven investments. So apart from that, we were also starting, and from the data collected, which we are actually the mirror, we try to capacitate the communities and the workers in terms of both the use of law, using the human rights lens, in terms of reviewing and analyzing what the laws and policy implementation look like, whether they represent a compliance or non-compliance to those international norms and standards. So we look at that, and we also try to bring capacity in terms of how do people understand the law? And what do they do when the law is violated? And when they don't like the law itself, and when the law are being used in order to oppress and to repress those already constitutionally guaranteed rights. And at the same time, we are also realizing that that it was easy for the state or even for corporations and other authorities to violate those rights if the people are not aware of those rights. So we began also in terms of capacity building, in terms of educating them what their rights are. So we have these published books in terms of Know Your Rights. It's basically in terms of the rights guaranteed by the Constitution, the international recognized rights, because Philippines is one of the countries which has signed and ratified so numerous conventions, both in human rights and labor rights conventions. It has ratified 38 convention of the International Labor Organization, and primarily in terms of the Convention 87 and 98, and how it is translated locally is another point. So we also in terms of that, from the data collection, we also providing capacity building, what we call the paralegal training, which is also legally empower workers, because we only have few lawyers that can assist workers to support workers in their complaints, whether it's in different authorities and different. So we also provide in terms of, this is also the basis for our advocacy. It's in terms of evidence-based advocacy, because as we are kind of challenging the official narratives and the official statistics, we need to really strengthen our own position in terms of why we dislike or we disapprove of a certain law or legislation. So we do legislative advocacy, and we had been successful in some of the engagement in terms of amending the law, in terms of pushing for a new law that will protect the wage, job security. Well, we are not yet successful in terms of pushing the law on job security, but we were successful in terms of pushing for a law on occupational safety and health, the expanded maternity leave, for example, and other labor rights standards. But we also do in terms of public advocacy. It is very important when we were told that these are only, for example, very recently the government has introduced that a family of 5 only needs $200 a month in order to survive and also to be elevated to a status where you are not considered poor. So the data is also very both empowering and empowering, because it have blocked the demands of the workers, for example, to demand for a higher wage increase using the official data. So we have to counter that by saying that, come on, it's $10,000 or $200 a month. It's not something that a family of 5 can survive and cannot be considered as poor, because it is not true. So basically, so the legislative advocacy, public advocacy is based on the evidence. And the third thing is also, it provides us also a guidance whether we should conduct a more in-depth research, both in terms of participatory research, which we mean that we gather numbers of community where they decide their own method, they all decide their own tool, and we analyze them. And the result of which we provide a midterm or annual review of the state of workers' rights and human rights in the Philippines, which is quite different from the official report that we provide. But in terms, we challenge that, and the consequences of that, of course, the government does not like us, although we engage in different government, especially now, it also, we are actually facing a severe attacks, especially on human rights defenders. And data can be a cause and reason. One is not only detention, but it has been used to file trump-up charges. In workers alone, there are more than 400 trump-up cases that we have documented very recently, only for the last 2 years. And then we have also, and data can also be very oppressive. It can cost lives. In fact, in the trade union movement at all, since June 2016, 42 of labor rights defenders and workers were extrajudicially killed, on top of more than 200 human rights defenders who who lost their lives because in the defense of human rights. But at the same time, it is empowering the community because the community can say that this is our space. You should not tell us what we are experiencing. And by gathering and collecting the data, and by honoring the data, by honoring the experiences, we are able to present that you are not the ones who are experiencing suppression. Your statistics or your data are in fact the ones sending us into poverty further, sending us into more like in detention. So we have a lot of cases, and we document that through the people that we attended the training, we organized them. At first, they were individuals, separate individuals. We call human rights correspondents. It's in the map that you will see is where the participants were. And then we realized that individuals are not as effective as if you are having a collective voice. So we try to do a worker-driven or community-driven monitoring and documentation. Now, in the last 1.5 years, we were, from that experiences and lessons provided in the past, we organized them into what we call Workers' Rights Watch. Both in terms of they are not unions, they are not associations, but they are able to organize people. They are able to provide a collective voice and collective representation of their demands and issues, but they are not, their identity is unknown to the state. They are just known collectively as a workers' rights watch without proper identity. Because profiling, the state profiling, especially at the moment, is quite common from the grassroots, from the community profiling, then the grassroots, and even NGOs. There are laws passed since last year where NGOs has to provide all the data. I mean, even we have the so-called data privacy law, it is not kind of a voluntary that you provide data. It is a mandatory requirement for us to provide all the data, even our constituencies from geography, locations, and individuals. Otherwise, the government can cancel our registration. And when they cancel our registration, we are included in a situation, in a category that they are only known to them, in a medium and high risk kind of organization. And it can cost not only our safety and security, but it costs the lives of many people who are defending human rights. And the other thing, I think the way we also collect data is through in terms of research. Research is very important, not only in sustaining both the advocacy, but it also in terms of providing kind of, to strengthen the data and information that the community provides. And it also in terms of understanding. And lastly, I think the main concern that we have is in terms of the safety and security of our sources. It is very important that not only we respect, we honor the experiences, but we guarantee the same. Although we cannot guarantee, there are no guarantees in life, as we say, but in as much as we can, we try to guarantee that the people have consent in terms of the data that you are collected, that they have that all the ethics that you have to have concerned, we call it the EPIC, the prior informed consent of the people, that they are not being used by so many other interests, because it can be used, their faces, the information, the data that they provide every day can also be used against them. So it is really important that we always have to respect them, to honor them, and in terms of, as I say, in terms of the consent. And we also provide in terms of security training, well, not as much as we would like to be in terms of the resources, but not only digitally, but even physically in terms of how we should protect the data in as much as possible. And one of protecting them is introducing a very, very low technology. We also gather data through SMS-based reporting. As long as they have access to even to analog cell phone, they can send us reports. And we have developed our own system, including our own database system of all the information. So the only problem is how to sustain and where do we store, because there's no place safe now in the country. So that's the kind of challenges that we have now. Thank you.
Thank you, Daisy. Next, we're going to hear from Mari Mari, who is here from Puerto Rico. And Mari Mari is one of the co-founders of Kilómetro Cero, so Kilometer Zero, and she has a journalism background.
Good afternoon. Thank you for the invitation to share our work here with you. I'm very pleased to be here. I will tell you a little bit about the story of our work in Puerto Rico, democratizing police data in the last years. To give you a little bit of context, in Puerto Rico, access to information is a constitutional right. However, we have no mechanisms, there are no mechanisms to access the information. We don't have a Freedom of Information Act or anything similar. So basically, although we have the right to access information, the government can really ignore you if you request any kind of information. And the only alternative that you have to fight against that, well, it's not the only one, but legally, it's litigation, right? Which we are currently litigating, but I'm gonna talk to you about the story before the litigation. So obtaining data from the police was always very difficult, but we learned in 2014, the police began to document for the first time in history, to document use of force. They had never documented use of force before. They had been able to document and create thousands of files of activists along decades of work. They could blacklist thousands of pro-independence leaders, thousands of dissidents, thousands of protesters. They had very specialized files on these people, but they never documented the use of force they exercised against citizenship. So after 2014, when we learned that they were starting to do that for the first time, we were very interested in those set of data. But it was very hard to access them. We had to develop very strategic ways to gather that information. Not all of them were illicit, some of them were legal. We had to do many things because the police was telling us, what they were giving us was, they were telling us, we're not killing everyone. We have no killings at all, zero, as you can see there. It's 0 people dead in this year and the year prior to that. I'm taking these 2 examples, but this kept happening since 2014. They were saying there were no people dead. So we had to gather other strategies because we knew that people were dying, but we didn't know who they were actually. This was not in the news, this was not anywhere. There were no media reports on this. So we gathered support from other stakeholders. People from the government actually helped us. Organizations in the government that the police had to be accountable to, that they had to respond to them, were generous enough to help us because they were autonomous organizations, civil rights organizations. And we finally received some information about the people that were actually being killed by use of force, by police use of force. But we said, but who are these people? We want to know what happened. We want to know who they are and why they were killed by a policeman, by the state. So that was still difficult because there were no media reports. We were putting these names everywhere, and there was not a single note on any of them, which was the first clue that I had regarding, well, these have to be people that don't have a lot of community support probably, because we knew that when a Dominican, for example, was attacked by a police or abused by a police, the whole Dominican community would denounce it. But what happens with these persons, these victims that nobody spoke for them? We were still questioning. But it was hard to tell because we didn't have access to the databases that could tell us more until Hurricane Maria happened. Hurricane Maria, as you might know, the death toll was thousands of people died because of the lack of electricity in Puerto Rico. So the Center for Investigative Journalism, which is a nonprofit organization that we are, friends with, that we collaborate with, they had to litigate to get the demographic registers database, and it had to be published because they won the litigation. So finally, we had access to a database on demographic registers, which is when we were able to, for the first time, begin to create certain profiles of the victims, of the police victims. And we were able to create our own database for the first time also. With the little information we had gathered from the police, we started cross-referencing with the registrar's office, with the demographic registrar's office, and create our own database, our own report on use of force. But especially the most important thing was that we were able to start creating these profiles on the victims. And we realized, okay, what were we seeing repeatedly in these profiles? Well, first of all, mental health patients were, most of these victims were mental health patients or were sick people. They were people with very little education levels. As you can see, this one, for example, who, Antonio, but I can't see the part of the name, which is down. But this person, do you see it? Or, bueno, this person doesn't even have a 12th grade diploma, and that's one thing that we were seeing all across the information. The profiles that we created, they had occupations that were also very low wage occupations, like this one was a mechanic. He was a mental health patient. He was a man, a young man, which is also one of the patterns that we see very often. And the causes of death were still very ambiguous because the demographics will say one thing and the police will say another one. But this man, for example, died. He had a sudden death, but it was under the police custody. Another thing that we were able to see was that from, the vast majority of deceased civilians were unarmed people. So how could these people pose a threat to policemen if they were unarmed, right? 18 of these victims were unarmed, and 7 were dead in custody, and 4 were women who died because a policeman killed them in domestic relationships. So, our case of Anthony Maldonado is, this is the first case where we have been able to collect data from the community. It's very recent. Anthony Maldonado was killed very recently in February by 2 policemen. Anthony is a young man, as you can see here. He had epilepsy. And his mom called 911 because he became a little bit, she doesn't even call him aggressive, but problematic because of the excess medication that he took and because he had constant convulsions because of his condition, because it was a chronic condition. So she called 911 and the policemen arrived, and what the media says, the media who never spoke to the family, said that he became aggressive, he had a machete, and he threatened the policeman, and that's why he was killed by the policeman with the firearm. But when you interview and when the family fill out our questionnaire, our survey, and were interviewed by us, the history was very different, and especially I want to talk about what the mother, Anthony's mother says, Elsa. Sometimes he loses control, is what she said, and 2 agents arrived at the residence after Elsa called the police to help her calm Anthony down. And one of the agents was from the same municipality and knew about his chronic condition. She says, when she hears the policeman saying, "Drop the machete," which she acknowledged, she says that he did drop it because he was trembling, his hands were trembling, so he dropped the machete. And what still resonates from Elsa's testimony was that she said, they arrived and they never tried to help him. He never heard anything, a word of help, a word of support, a word of empathy. I was expecting them to tell them, Anthony, we're here to help you, we're policemen, we want to help you, quiet down, we'll figure this out. No, de-escalation. De-escalation never happened, and that's what she says. And they not only killed Anthony, they also shot exactly where Elsa and her brother were standing at in her house. The policeman shot the mother and the brother, Anthony's not uncle. So I'm out of time right now, but we can talk a little bit more later. But yes, that's one of the cases. Oh, okay. I thought so
You are correct to wrap up.
So
but-
this is information that we've gathered, that we were there. We saw the shots that they received, the family received. Anthony was killed. The policeman told the mother, taser, this is a taser. So she thought, but no, they used a firearm and they killed him. She thought her son was going to somehow come back because she didn't quite understand what a taser was. But she knew that it didn't necessarily mean that he was gonna die, and she would see him bleeding, but she didn't understand because they were saying, no, this was a taser. So, he was gonna come back to her. And she kept waiting for him to come back and ask for the policeman's help to bring an ambulance or something, and they didn't do anything. So these policemen are not, charges have not been pressed against them. We are using this first story of documentation and storytelling from family members that we were lucky enough to gather, because this is very difficult to gather this kind of testimony. And we're using this to raise awareness on the necessity of pressing criminal charges against public officers that commit violations like this one. I mean, it's an extrajudicial execution in our understanding. Thank you.
Thank you so much, Mari. Our next panelist is Ron James, and he's here from Guyana. And Ron is a GIS specialist, and he is the mapping coordinator for the Amerindian Peoples Association in Guyana. Ron earlier said that the government has used maps against his people, and thus they respond by making their own.
Thank you. Good afternoon, everyone. Again, my name is Ron James. I am a Wapishana, one of the 9 indigenous tribes of Guyana. Again, Guyana is the only South American, English-speaking South American country, and a lot of people take it for Ghana. So sometimes it's confusing for them from where I come from. But yeah, I work with the Amerindian Peoples Association, which seeks to promote, protect, and defend indigenous rights in Guyana. I also volunteer and have been working for the last 15 years with the South Rupununi District Council, which is the representative body of 21 communities, which majority of those communities are Wapishana. So one of the things that we have a small population. Guyana is just 780,000. But the majority of the population live on the coast. The rest of the tribes, most of the indigenous tribes, probably 95% of the indigenous tribes, live in the forests, in the mountains, and in the interior of Guyana. So what has happened is the gold extraction, diamond extraction, and the timber industry is very huge revenue earners for Guyana. And all of these, most of these are found in indigenous territories, or the places that we live. So you have majority of the government coming from one geographical area and from the city. So a lot of the times they make decisions for how we live in the communities. So with that, they grant us titles. Titles for us is, there's a process that we have to go through. We have to apply for the title. We have to meet certain criteria, certain population. We have to make justification of our attachment to the land, spiritual attachment, how long we're living there, and stuff like that. But one of these things is that a lot of times the government have used old maps that were made since before independence. Guyana was gained independence in 1966. So these maps are black and white raster images with contours, which a lot of times our communities don't understand. These maps have been made so long, the river names are wrong, and it doesn't really look realistic. What has happened is that we have realized that a lot of times the government comes, they put up these maps, they have this consultation discussion on titles, mining concessions, or conserved areas, and we don't understand where they are. So we, the Wapishanas, decided to embark on a mapping project to map our own lands using the government database. We mapped our territory. We included names, rivers, names of rivers, mountain names. We mapped where we fish, where we hunt, where we gather. And of course, we live differently to the rest of the population of Guyana. But in doing this, we started, I heard my fellow panelists saying, some of the information we got, the data we collected was kind of illegal because the government doesn't want to give you information. So a lot of this data we gathered from some of our friends in the GIS department, in the different land departments, and different departments who deal with lands. And we overlay this information on our maps. A lot of times we think that our land is just ours. There's nothing happening on it. But when we overlay the information, we started noticing different things. We noticed that our title boundaries were wrongly depicted on the government maps. We noted that some of our fishing areas, our gathering areas, our sacred sites, there were mining concessions over them. We noticed, so we started gathering a different picture when you overlay the government information. And that was something because it is hard to get current information from the government. So when we started doing this, we started using this, our maps, along with the government information to advocate for some changes to be made in the government. But the government was annoyed because we were presenting their information on our maps. So grudgingly, they started moving in some sort of direction. Recently, I saw a publication in the newspaper in Guyana that it is the the lands department is the only authorized body to conduct a survey or do mapping stuff. The rest is illegal. But what has happened, the government maps are so bad that a lot of times when they come and consult, they have been using our maps because they're far more realistic, and you have, we've been using satellite images to enhance the maps and the 3D imagery and these things. So they have been using it, although it is illegal. So these are one of the things that we have used our data to be able to understand different aspects, to try and advocate, to show the government what is there, and to also use shape files, which are, well, not illegally, we didn't steal them, but to show them what we have over there, and that is something that has been something very good for the community. Now, in that, the communities themselves begin to see and have a different appreciation for maps, because a lot of times we know where our areas are, we know where our mountains are, or creeks, but we don't realize when you have to depict it on a spatial for somebody else to understand, it's something different. And then you tend to start seeing how near these mining concessions are, which rivers they're going to affect, which watersheds. So these are like really important information, and I think if we didn't have our maps, the government never gave us this information in one file. Now with the maps, we started doing because again of the mining situation, we started monitoring the mining concessions, mining activities. And we started noticing, we started documenting environmental and mining breaches we have of the law. So we have started documenting these, collecting data, presenting it to the government. Again, that is something that they don't like because governments are very corrupt. Although you have regulatory bodies, they don't present this true picture. So we have started advocating for information and some of our monitors to be given some legal status, because sometimes it is, the miners are very aggressive towards us. And these mining concessions, some of them are not in our title. They're in our traditional area, which we consider ours, but we go and monitor them. And so a lot of times we are met with opposition by both the government regulatory bodies and the miners. So sometimes the work is very dangerous for the monitors, and this is something that needs to be addressed slowly. Some of the things that we discovered, though, is that the government is very afraid presently to address mining issues because a lot of them are over our titled areas. And the government has not updated their database with the current titles that they have. They have old plans. So they have been, the agencies have been negotiating with companies over indigenous lands because their database is not up to date. And this is something that we have pointed out to them, and they're beginning to. Some villages actually are out of their total title. Because again, how they grant title is like someone sit down in an office in the city and draw a map for you in these areas. So these are some of the things that are happening there.
Ron,
How long was that?
this is a great time to have final comments, and then we'll
Okay,
return
sure.
to you with questions.
Okay, yeah. So in this, I think one of the things that we really like is access. Our fight is the right to our lands, the right for people to see how we live, and the right for us to protect how we live. And without us generating this data, nobody would do it for us, and the government is now willing to do that for us. So thank you.
Thank you, Ron. So our last presenter is John Waters. He has also come from a far warmer place. John is here from the Dominican Republic, where he is the director of the. John is going to say his title. But John works with populations that are vulnerable to HIV, specifically in sexual and reproductive health. And they use a community-engaged approach with their research.
Thank you, and it's great to be part of this panel and bring to you some information about our experiences generating data in the Caribbean. I don't actually need to really move the presentation along.
Really?
Yeah, just at the end maybe. I've got some pictures for you. But yeah, I entitled this Breaking with Business as Usual, and looking at the ways in which community-based organizations have partnered with academic institutions to collect data, strategic data. Essentially, just to say a few words about Caribbean Vulnerable Communities Coalition, it was founded in 2004 by a renowned Caribbean human rights activist, the late Dr. Robert Carr, who was an academic, incidentally. And it's the largest indigenous regional coalition of civil society leaders, actors, and organizations. We group about 60-odd organizations that work with marginalized populations that are especially vulnerable to HIV throughout the Caribbean. And we work across the cultural and linguistic barriers that we have in the sub-region. So we work in French, English, Spanish, and Dutch. And CVC provides a platform for policy dialogue, coordinated responses that address vulnerability, human rights, and sexual health.
John, sorry to interrupt. When you hit the arrow on your laptop, would you also hit the arrow here? This is the coordinated computer. I apologize for this technical disruption.
Okay, no problem. I'm not a very good octopus. So
Why don't, actually, I propose, let's you and I switch seats. Just bring the clicker over here.
Sure. Can do that. Are you deducting this time for my presentation?
No, I have not been monitoring very closely.
So yes, I was saying that essentially, the traditional model that we've used when it comes to collaborations between academic institutions and civil society organizations is one where you've basically got research institutions that partner with CBOs or community-based organizations. Those academic institutions develop the research protocol, so all the methodology and all the rest of it, and they typically direct data collection and analysis. And the CBOs are essentially relegated to providing access to the populations. And for the longest time, that was kind of the modus operandi of that kind of relationship. However, I think there's certainly a strong rationale that is emerging in terms of causing community-based organizations to rethink that particular approach to research collaborations. And one of the things that certainly a lot of NGOs face is pressure in terms of the evidence base for the interventions that they're carrying out. And at the same time, a lot of the academic institutions are being pressed to do research that has relevance to real-world issues and to policy issues. So that kind of creates a favorable environment to renegotiate some of the ground rules in terms of these typical relationships that have occurred between civil society organizations and academic institutions. So one of the things that we did at CVC was that we realized it was actually strategic to have a specialized research unit within CVC's work, and that this could provide a great space for us to address and negotiate and better negotiate the differences that often surface when working with academic partners, and being able to exploit what each partner can bring to the table. So essentially, CVC, by drawing on the work it's doing on the ground as a coalition with members throughout the region, and also by building the research capacity of those local organizations, and the trust that those organizations have gained with key populations on the ground, have been things that we've been able to use when we negotiate with doing research proposals. And basically, although definitely there are many occasions where the relations have been a little bit strained and where it's kind of been like a cat-dog relationship. I'm not sure if I'm forwarding it. Is that? Yeah. I certainly can't say that there hasn't been difficulties working out a working relationship. But on the whole, I think we've found it's kind of been something that's been a win-win situation for both parties. And certainly as CVC, I think one of the things that we've benefited is through these partnerships is that often the activism that we do, or that we need to do as a civil society organization, kind of lacks the reflective lens that some of the research institutes can bring to the work. But I really stress the fact that it's a two-way street and that there's been mutual capacity building. And that's not typically the way we often think of things. And I think the tradition has been that you've got these institutions from the north that come and strengthen civil society organizations in the south. But I can certainly think of lots of examples of the capacity building happening in the other direction. And to cite a couple, for example, we've done work with the University of Southern Florida in terms of the university being able to kind of revise and perfect modeling approaches, in this case, specific instances to motivational interviewing, by offering field work in the Dominican Republic and an opportunity to perfect those models with, with practitioners in the Dominican Republic, or the extent, for example, to which we've collaborated providing field internships and placements with individuals from the University of Alabama at Birmingham, students that have enriched the curriculum of those students. So I'm going to speak a little bit specifically about a particular venture, that research venture, which has to do with population size estimates. And Peter, in the earlier panel, kind of introduced you to some of the terminology and the relevance of this type of research work. But basically, estimating the size of the populations of MSM, of sex workers, of persons who use drugs, etc., is critical information, not only for NGOs, but also for the government in terms of planning services. And it's been extremely difficult to be able to conduct these studies, particularly in the small country context that we frequently have in the Caribbean. So oftentimes the methodology is developed. In the case of the population size estimates, a lot of it was developed in the greater San Francisco area. But when you try and implement that in a country the size of St. Lucia, where you've maybe got 100,000 people, it's not at all the same. And so typically in regions like the Caribbean or the South Pacific, it's been very difficult to obtain reliable data. And so this case study is, I think, the idea of what I wanted to do with this was basically to show how we were able to take gold standard methodology that's developed far from the Caribbean and adapt it, make some critical adaptations and variations as a civil society organization that is working on the ground to really improve the results obtained. And just like Peter was saying, I mean, these population size estimates are something that are being funded through the Global Fund, through PEPFAR, in all of the regions in the world, and a lot of money has been spent on this. Our experience in Central America and the Caribbean is that often this data, when it's presented back to the groups that are doing the work on the ground, they just sort of look in disbelief because all of this money's been spent and they don't identify with the results that are being presented. So just some of the results that we were able to do actually doing the research ourselves. We were able to get much larger sample sizes than were achieved in earlier attempts. Particularly with the OECS, there were numerous attempts that flopped, so that studies that were abandoned after having spent half of the budget and not producing any results. Other studies, I think there was only one study that was done with sex workers in Antigua that was actually completed, but the data that was presented was really refuted by the key populations on the ground, and so they've never really done very much with the data. So being able to have much larger sample sizes that we can strengthen the the robustness of the data was critical. We were able to identify a series of subgroups of MSM and trans women and sex workers that were previously unknown or poorly characterized. And I think one of the good examples of that, the existence of local women who are involved in sex work, because in the OECS there was a great denial that the sex work was actually taking place with locals, and all of the work that was being done was with migrant sex workers from the Dominican Republic, from Jamaica, from Guyana. So really putting a large subpopulation of sex workers involved in transactional sex, sometimes that were off the map in terms of the planning. We obtained additional buy-in of the study results from community-based organizations that are actually in those countries. The numbers seemed a lot more real to them. I mentioned the issue of cost savings. I mean, the cost savings can be huge, and in this instance, because we were able to do this for a lot less than was budgeted, the funds could then be used for something else. And so there was a study done in Belize that I know the numbers for, so I'll refer to that. But there was a study, a population size estimate study in Belize that was done. They spent $756,000 doing the study. It was done by an academic institution that I'm not going to name. And they managed to get a sample size of 300. We did a study recently in Belize. We spent $156,000 and we had a sample size of 1,200. So, and a lot of that isn't really doing things in a majorly different way. I did mention we made some specific modifications to with the methodology, but a lot of it was the way we worked and the way that we involved community-based organizations, not simply to reach the population, to give us access to the population, but really involving them in all of the aspects of the research. And I think one of the things that I'm most proud of is the extent to which the whole exercise of this participatory research approach, the extent to which it really builds capacity within the community-based organizations. And a number of them have gone on to do other research proposals and actually to submit actual proposals to funders to do research. So in concluding, certainly as in many other regions of the world, key populations, these marginalized groups that are that often face pervasive and persistent health and justice issues, really should have the right to access good research. And yet, unfortunately, in the past, they've typically been subjected to extractive, irrelevant, and even exploitative research. And when the research is available, often it's not very good research. So CVC really feels it's critical to ensure that community groups are properly engaged in research processes and that they have at their disposition information that's accurate, relevant, rigorous, accessible, and useful to them. Thank you. Yeah, cats and dogs can get on.
Thank you, John. I know that the audience has questions, thus I'm going to ask the panel just one set of questions. And I propose that we go in the order with which we spoke initially. So Daisy, we'll start with you. The two issues that most interest me, first, to return to what John said in terms of adapting methodologies in the context of the San Francisco study and the ways in which you then implemented that in St. Lucia. I'm interested to know how each of you engage with communities to ensure that they participate in the construction of this knowledge, the construction of this data. So that's element one. element two, and please perhaps keep your comments just to about 2 minutes if you can each. Element two is really this concern around the risk of making populations visible in certain ways, particularly those that have not been visible in the past. I mean, for example, identifying those who've been murdered by the police in Puerto Rico. What are the ethics of making this population visible, and how do you ensure that you get consent in this context? And I think that, of course, applies to you, Mari, but could apply particularly to you, Daisy, as well, but also to all of the panelists. So thank you, and Daisy, we'll turn to you.
Thank you. In terms of how do we involve communities, we start with meeting with the communities. We decide our own tools. We decide our process of collection, and we also decide when the community decides on which interest more in terms of how the reality and how their experiences can be expressed better and more effectively. And the methodology, we don't use a very standard, as in very standard methodology. When I say standard, is what officially is recognized. And in terms of like surveys, we also do surveys, we do interviews, but we also, what we call amongst women, we use the feminist participatory action research. We decide our tools, coding, and everything, something like that. And then we also, in terms of research, I think the most effective that we did is when we do interviews, but we decide in terms of the interview questions. And even the populations, and whether we use representative populations or we kind of samples, and what kind of sampling we shall do that can effectively represent or mirror the reality. So, and we do also focus group discussion. The questionnaires we decide amongst ourselves. And most importantly, we enlist volunteers. We train volunteers, for example, workers. In the research that we did, example on child labor, where we challenge also the dominant narrative that child labor is decreasing or declining in the Philippines. And then also in the orphan plantation, for example, is giving or generating employment. We challenges, we engage at least on a 1.5 year of research. With sample population actually is 3,000, including in 2 provinces, which is also 10 involvement of around 7 municipalities. It's very empowering for them, because even themselves, they tend to believe that a palm oil plantation, for example, generate employments. But when we release the research and even publish the book, collecting the stories, we collect testimonies. We are very strong in terms of collecting testimonies. Our data is also supported by fact sheets that are legally recognized. We also use sworn statements because it also supports complaints, whether we file it in the appropriate courts or in terms of other commissions, even up to the UN. We provide alternative reports when the Philippines is under review on the Universal Periodic Review, for example, in terms of its commitment on the economic and social rights of the people. So we provide alternative, and it's been recognized and used as basis to provide the positive recommendations. Our recommendations were also carried out, which we also use in terms of pushing for legislations locally at the national level. In terms, for example, in terms of women, the gender pay gap is still existing in the Philippines. So we look at the expanded maternity leave is also actually a product of the review that we have submitted in terms of the lobbying, years of lobbying, and the testimonies, the collection of stories of people. So it provides and strengthens all the data. And when the community sees that, the kind of reality that their lives are reflected in those data. So we always say that data is not about numbers. It's not about statistics. It is also about people, as the earlier panelist said. It's about people. It's about the reality. It's about that truth. It's not the truth that is distorted officially, but it's the truth how the people lives, how the people in terms of interact with their environment. So in terms of risk, I think it's also collecting data from the community is about trust. I mean, the organization that you represent should be trusted by the community. It's also about trust relationship. So we build also relationships simultaneous to the process, how we collect and how we collect the information. I think those three are fundamental because people will not give or will not share their stories if they don't trust you. And the thing is, we have to provide consent. I mean, we have the system we call quick response teams, which we dispatch whenever there are incidents of human rights violations in communities in different parts of the country. And for example, the cases of extrajudicial killings, people are mourning, and you have to be sensitive to what they are feeling. So not only the consent, not only the respect, but in terms of sensitivity to the context of the situation they are having. So the risk, we don't provide the information. In research, we have the policy that we don't give raw data. It has to be written in the contract that raw data should not be provided to our partners. And we only do research for two reasons. One is in terms of to support or strengthen in terms of pushing for the basic demands. And then one is in terms of how we can use that for advocacy, whether it's legislative or public advocacy. And then we provide the identity. We do not provide the identity of our constituents, of our beneficiaries, even if the government requires it. If the partner requires that we provide the identity, the location, as to geography and as to individuals, we don't accept that, and we take all the hit. That's the challenge is the organization like the CTUHR should take the hit, not the constituencies or the communities. So although we cannot guarantee that they are safe, but in somehow we provide them kind of guarantees that yes, we will take all the hit in case if the community is threatened because of the information they have provided to us. Thank you.
Well, that's a very good question because that's, you learn about many cases of police brutality in our case, because you hear, people tell you different things, and you learn of all types of experiences, but very few of those experiences can you actually document and publish extensively as we wish. Because first of all, we don't chase for cases. We are only working with self-reported information with people who come to us, because we make our work visible, and then when they come to us, most of them already have the will to actually, to speak their case and to document it and to speak freely. Most people, for example, just to give you an example, recently I received a message from this woman who wanted to document her story. She wanted us to advocate with her case because her ex-husband is a policeman and he's an aggressor. And even though they divorced already, he's been using his power as a policeman to intimidate her to a great extent. And it was a very, of course, it was a very, it was a case that seemed very dangerous to me. I mean, for her, obviously. She was very sure that he wasn't gonna do anything to her, that he was intimidating her, but she would tell me, no, but he won't, he's not going to kill me, he's not going to make anything physical against me. Before we went on to document the case, I discussed it with domestic violation, is that the word? Domestic domestic violence organizations that we collaborate with, and we determined that she needed to first have lethality evaluation that she didn't have. She was very sure that he wasn't gonna do any damage to her, but we weren't that sure about that. Most victims seem to be, they usually think that the aggressors are not going to do anything bad to them. So we didn't document that case because she hasn't been she hasn't made the lethality evaluation yet. So, I mean, this is a work in progress because we are creating this organization and we are establishing our protocols and our policies. But that was one of the so we have been lucky to receive some cases, but we never chase for a case. We can advocate for a case without documenting it, which we have done before, like this man, for example, who was killed, a Dominican young man was killed by a policeman. I met the family I was being interviewed on TV, and they were also, so I met the family, and I told them that I was available to support them, and in different ways that we could support them. They didn't want to work with us. The Dominican community has their own advocates and their own organization. That doesn't mean we will not advocate for those cases. We always did. We don't need to go into deep documentation of every case. We can advocate. There are different ways that we can advocate, and that's what we do when we don't have the possibility of documenting a whole case in depth.
Yeah, thanks.
Okay, I will try to answer this from a mapping perspective. Mapping in Guyana community mapping has been a challenge because we had prior mapping projects in Guyana, 3 previous mapping before the Wapishana mapping project, and this was the only successful one because when we were doing it, it was in 2000, the technology was really difficult then. We didn't have all the software that we have and all the open source and all the different technologies that we are having now. But our maps were made kind of trial and error because we tried to use different approaches. Because we have been mapping a huge area. We include a lot of elders in the community, and we have gathered information that is not publicly available, and we will not release that. And the only way we'd release that is by asking permission from the elders. It might be elders, it might be the shamans, it might be, we have places of documented gold, which is something that we cannot release to the public because one of the things of mining, the mining superstitions from the miners is that everywhere that indigenous people live, on their village you have gold underneath. And that is something that is really heartbreaking for us. So, but our maps are still a work in progress because we have realized that we haven't mapped out everything in our landscape because we have other areas, spiritual areas where where the shaman uses for training grounds. There are other areas of spiritual significance which we haven't mapped, and it is very far from the villages themselves. So it is still a work in progress, and how we present that and who we present it to is something that we have discussions with. And I think that is why it was important for our communities to form a representative body of leaders, which is what we volunteer for. And so you make decisions collectively. It's a slow process, but I think it's something that works for us. Yeah.
Yeah, thank you. That's another theme from this morning, I think, just slowing down and the necessity to do so. John?
Yeah, maybe just a couple of points on the whole business of risk. One of the things that we got given a hard time about was informed consent. And this actually came from a number of different sources. We got pushback in terms of how we thought it was important to do the informed consent because we really didn't feel comfortable in terms of the traditional way of getting participants to sign an informed consent agreement prior to participating in a study. We found that oral consent was a much better way it was much less threatening to the participants, and it also gave us an opportunity to address issues of low literacy, etc., and to better kind of cater to the individual participant in terms of the explanations that were necessary for that individual. So we've always pushed for oral consent, and we got pushback from ethical review boards, we got pushback from all kinds of places, including peer-reviewed journals. Fortunately, that seems to change a little bit, and I think oral consent's become something that's more acceptable. But I think with key populations, it's often critical to be able to provide them with oral consent. Lots of times, obviously, in situations where the behaviors are criminalized, anybody who comes forward to speak about human rights abuses is also admitting to being involved in activities that are considered illegal. And I think frequently those individuals have that question about, well, you know, what's the risks for me and what are the benefits of doing it for me? And that's often a difficult thing to be able to answer them, looking at them straight in the face. And although I didn't talk much about that kind of area of work, but one of the things that CVC has done throughout the region is really to document cases of human rights abuses. And I think one of the things that's helped me in terms of doing this work is it really came after a period of time working on the ground with organizations, helping them document human rights abuses, because frequently the people would come to you and say, well, you know, what are the benefits to me? And I wouldn't have much to say in reply. But a couple of years ago, we began to see some of the fruits of that, and the organizations began to see some of the fruits of that documentation work. And at least in my involvement in this type of work, there's like a before and an after moment. So a couple of years ago, the Transgender Sex Worker Coalition in the Dominican Republic, COTRAVE, was able to present at the Inter-American Commission a report that was based on the documentation that organization had done. And for the first time, the Dominican state was not able to dismiss the information as anecdotal. And so having the director of the organization come back from the session, you know, and seeing the extent to which she'd realized that this had already paid off, that was a very powerful moment. And I think, you know, sort of now when people ask me, well, what's in it for you? I have an example I can give of, you know, of how this can actually make a difference.
Thank you. We have time for certainly 2 questions, and I think we'll take 2 and then evaluate. So please raise your hand if you have a question for this panel.
Well, first, thank you so much for this really rich panel. I actually just want to elicit a story from Ron, if that's okay. Ron, I think one of the most powerful stories of the success of your mapping is convening a meeting with the president. And I wonder if you would be willing to talk a little bit about that as a success, or however you view it.
Yeah, there have been several.
We will take one more question, and then of course we know only Ron will answer. We won't make Daisy answer that question.
Thanks again. Quick question: what efforts or what strategies do you use to bridge this divide between data and evidence and knowledge that's generated from community and community experience, which is often dismissed as anecdotal, etc., and official data statistics that's been validated, recognized, or given the cloak of recognition by either government or an academic institution, oftentimes in a different geographical space. How do you navigate that? Because I think the politics of knowledge and data is something that's alluded to very strongly in this panel and in the panel before it. So what are you doing, and how do we as allies who work with community groups in other capacities, what should we be doing to make the process of validating and recognizing your evidence more democratic?
Thank you. That's an excellent question. Let's start with Ron, and then we will turn to that.
Okay, thank you. Meg. There have been some successes with our mapping unit and the monitoring program. We have presented a report to the president, which have triggered some action, and he is committed to convening a task force to deal with some of our specific issues. One of the things is that it was the right time because he is into this whole green economy, and he has committed on the world stage to establish certain areas as conserved areas, and indigenous peoples areas have been, indigenous peoples have been known to, by just living their lives in the way that they have traditionally lived, have been considered conserved areas. But apart from that, some of our reports and some of our maps and the data that is generated have some impact in other ministries.
I'm told to bring the microphone even
sorry.
closer. Thank you.
Have had some impact on other ministries, because recently the Minister of Natural Resources have started having this conversation of protecting certain waterheads and watersheds based on the data that we presented and some of the maps that we have presented. So by doing this, it gives, I think, by showing them the evidence, showing them data that they probably don't generate for themselves, because I'm sure that most of the community agencies don't look at watersheds, don't look at critical water sources as areas, because it has no concern for them. But when you show them how it impacts you, they start thinking differently, and I think that is the power of some of the information that we do generate.
Thank you. Who would like to first respond to this, I think, quite excellent sort of summary question about the tension between community-produced data and then data that's from the quote-unquote official sources?
Yeah, I'm happy to have a stab at it. I think essentially what we've learned at CVC is that it's critical to really be at the helm of the research that's being done. And so that really requires you to build capacity so that nobody can refute your data. So you really need to get as good at the data collection and the data analysis as anybody else. So that that's critical. And in the process, that really requires building relationships with academic institutions. And so, that certainly has been a big part of the success of what we've been able to do. We couldn't have done it on our own. But it's also about realizing that you're in a strong negotiating position as an NGO because you have access to the population and you also have knowledge that the academic institution doesn't have. So really to be able to use that to negotiate for something that includes capacity building for the NGO in action research and other things, and ensuring that the key populations are involved in the data analysis, because that's often the piece where they get totally dropped. And I think some of the most powerful stuff that we've been able to do has been involving the groups and deciding, well, what type of multivariate analysis do we need to do on this data? We can't do it on all of it, but let's determine the questions based on the discussions with the key population groups.
Thank you, John. Daisy or Mari, would you like to contribute?
Thank you, Ellie. How do we bridge the gap? on our experience, I think we also use official data. I think especially at the macro level, we try to always in terms of how do we compare and contrast the official and the community-based. And we used our leverage by having a solid kind of relationship in the communities. We also, in the process of research, we involve a lot of stakeholders, the academe and the other institutions that are involved, or specifically also related to research. So the communities, we also present, and we have a means of verification of our reports. I mean, we receive lots of reports of human rights violation, for example, using SMS or social media platform or other means. But in terms of verification, specifically the fact sheets, we provide fact sheets for each incident, and also even the fact sheets and sworn statements, which for those who are willing to risk their lives in order to provide that kind of the truth. So by using and by optimizing this kind of leverage of having a community relations or community-based relationships and of different, and also the academe, and in terms of comparing and the government releases data regularly except for child labor and other economic and political. So we are able to compare and contrast whether what the official is saying is the actual reality on the ground. So when they speak about this is what is happening, for example, they were saying that the Philippines is the second fastest economic growing country in Asia. So, and then what are the bases? What are the reasons? What are the causes in all aspects? So we look at the labor and economy, for example, or how are they, it's not in terms of how, we always question also the process, how they come up with kind of results, what are the methodologies of, and even we question the official methodology in terms of determining, for example, the unemployment, in terms of the wages, in terms of, so we have this process we have developed, and then as my colleagues here are saying, it is also about trust and relationships. So you have that. One is, again, is you really have to say and also to know what are the macro at the macro level. So we have the macro level understanding and analysis of the official data, and then also at the same time at the micro level. So we provide at the micro level whether what is being said at the broader level is the same as what is happening at the ground level, which is the micro level of the statistics. In that way, we are able to provide a kind of an alternative sense of review or analysis of a certain situation. Yeah, I hope it answers.
Mari or Ron, do you want to comment, or shall we take one more question? Let's take one more question. People can always return to this as they like. I see one over here.
Hi, my name's Rebecca. I work at Human Rights Watch, and I'm currently doing research on broken windows policing and how it affects Black immigrants. And so, Maria, a lot of what you were saying had a lot of resonance for what we've been seeing that goes on in New York City. My question was about, since so many of you engage in research, what accountability looks like. So as someone who works for a large human rights organization, this report I'm working on is with the Black Alliance for Just Immigration, and it's a joint report with a local grassroots organization that works with Black immigrant communities. And so for us in that report, our accountability as a researcher for me is with the immigrant communities that we're working with and with the people who are directly impacted by police violence. But when we come out with the final report, a lot of what the public will see is just the synopsis of our findings and the report and what is publicly available, and everything that you've all been talking about that's been super interesting about like methodology and community safety and consent, that isn't necessarily like publicly available in the document. So what does accountability look like for you in the research that you do? How do you ensure that you're getting feedback from communities? And I know for a lot of you, these are life and death situations, so I'm just interested to hear more about that.
But you mean what it looks like within our organization, or do you mean what it looks like to us regarding government accountability?
I mean, what it looks like within your organization and within the work you do and within the people who, you're working with to collect data. What does that accountability process look like in terms of like how they feel about the final output, how to make sure that they're like, how they feel about how the process works, essentially?
Well, at least in my experience, because we are just beginning to step on this project on collecting community data. What we have done extensively is working with the government data, and we are just, beginning to collect data from communities. We have a survey developed. We're still we've had to do it already because we receive people that have their stories, like this story that we were talking about, like Anthony's story. But it's not something that I can, that I feel comfortable, talking about our experience, because I feel that we are just learning how to do this as we do it. So we don't have like a vast experience on community collection. I don't know if the colleagues here who
Would
have
anyone
helped-
else want to comment on this question of accountability and how you ensure that you remain accountable to the communities with which you're working?
Yeah, I can say something about that. I mean, what I've seen in the Caribbean is that there's kind of two models. One where you've got an organization that's like a voice piece. And so for example, there's a number of observatories, human rights observatories, and they typically put out information based on data that's collected within the communities, and there's that model. But there's also a model which is more what CVC's been doing in its documentation of human rights work, where we actually work with the grassroots organizations themselves. And so we build capacity and we support, through funding that we have, we support paralegals within those organizations. And those organizations are not only collecting the data, but they're also deciding how to use the data for advocacy or for whatever other purposes. And so in that case, to me, that's the ideal case, because you are empowering the very individuals themselves to use that data for advocacy. So it doesn't need to come through an international NGO or a voice piece. It can actually be something that they take to the Inter-American Commission, or that they decide how to use that data.
That's what we do. Yeah.
I think that's an excellent final comment to end on, unless any of you would like to say one more quick thing. I think each of these individuals are leading or working with organizations that do exactly that, or supporting communities to generate their own data and to ensure that that data is taken seriously by a variety of actors. So thank you so much to each of you. Oh, and Ron has something to say.
I just wanted to comment on something with the data. Because Guyana is considered a third world country, for the indigenous people, there's not a lot of access to cell phones and internet. So some of these things are abstract. Just on a final point, one of the things that the community wanted for their information, their data, is they wanted hard copies of everything, because that's the only way they know how to keep these things. So that's a challenge for us, and sometimes when we explain these things to them, it's hard for them to conceptualize and understand. So, yeah, it's just a comment I want to make.
Thank you, Ron, thank you, Daisy, thank you, Mari, and thank you, John.
Thank you.